I'll begin by welcoming everyone who's here. We can't see you, unfortunately, but we trust that you can see us and hear us. If you cannot, or you're having any difficulties, just type in the chat, and we have some ability to control the system in the background. But good morning, good afternoon. Welcome to our session on coordination for scaling impact. On behalf of my colleagues at the International Development Research Center, Haley Price-Kelly, Shaliza Ramji, and Amy Etherington, and my colleagues at Southern Hemisphere, Dina Lomovsky and Petronella Nsubi. We are really thrilled to have this conversation with the attendees at this conference. We have encountered some technical difficulties in the way we wanted to run this workshop. So we were just going to tell you right off the bat that the majority of the session is going to be done in this plenary, which we think will have some advantages too. We'll get to have broader conversation later in the session and share ideas across the entire group. But we won't be doing the breakout groups around themes we had hoped for originally. So just an overview from me before we get started of what we'll do and what we'll hope to accomplish by doing these things through this session. We'll begin with two presentations. The first from my colleague, Haley Price-Kelly, and she'll look in depth at this notion of coordination, and she'll explore what that's meant for our work at the International Development Research Center. And then we'll turn to my colleague, Dina Lomovsky, who has been a learning partner and critical friend of this project for some time now, and has actually been putting it into practice at IDRC and with other organizations through her work at Southern Hemisphere. So to give some practical examples of strengths and limitations of this way of thinking about partnering. After that, we'll open a Q&A with the two panelists, but we'd really like that to be an interactive discussion. So at that point, what we'd like to ask you to do is to click on the upper right-hand side of your screen. You've probably seen this already in other sessions you've been in, but if this is your first session, there's a little blue box that is a request to share your audio and video, and you can place or ask your question that way. You can also type it into the chat, and I'll try to keep a record of those. So after our discussion of the presentations, what we'll do is we're going to introduce an activity that we've been using that helps bring this conceptual idea of coordination to life. And it's aimed at application by researchers. And so we hope that it might benefit or have some value to the research you're doing, and this short exploration of that tool will be of value. Then we'll return following the exercise for some group discussion, looking for some areas to improve the work. So before turning to Haley and Dina to kick us off with the explanations and the further detailing through their presentations, I just wanted to make two framing comments about our session. So as an evaluation officer with the International Development Research Center, I have the real privilege of working with researchers, innovators, scientists, entrepreneurs around the world across our portfolio of research. So what we do at the IDRC is we fund research and innovation. And as an evaluation officer, I get to study, work with, and learn from those colleagues. And that's very exciting work to do. And what we're going to talk about today, this notion of coordination and scaling impact, is derived from a study which is comprised of evaluations, research, global exchange, case studies, guidance and tools that have been developed and tested in different settings. And we hope to further it with you this morning. And that's been centered around a project we've called Scaling Science. And that leads into kind of the second framing point I'd like to make. And that is what we hope to accomplish and what we hope to do in the session this morning. We've purposefully chosen that title, Scaling Science, because the point of this research project from IDRC was to think about better ways that we could scale the impact of the science, the research, the innovation we fund, to make it more meaningful, more equitable, more sustainable for people. But it's also a play on words. And so we've learned through this work that there is no blueprint for scaling impact. There is no single method or approach that's going to hold in all contexts and circumstances. And so I do hope that through this session, we push our thinking further. We learn from each other and from you. And if you have any interest, if you find this work intriguing as you go through the session, keep in touch with us, because we are committed to furthering this notion of the science of scaling. We think there's a great opportunity here to expand the way that research can benefit people and planet. And so with that framing in mind, I'm going to turn over to our first panelist, who is Haley Price-Kelly. She's a Senior Evaluation Officer at IDRC, and she'll introduce the notion of coordination and what it's meant coming out of that research we've done at IDRC. So over to you, Haley.
Great, thanks very much, Rob. I'm just going to put my presentation up. 1 second. Okay, can everyone see this?
Looks great, Haley. Perfect.
Great. So as Rob mentioned, I'm going to give a bit of an introduction to our work at IDRC on scaling science, and specifically look at this principle of coordination that we consider in our work on scaling impact, and how this relates to thinking about broadening our approach to participation and partnerships in relation to the theme of this conference. So just before kind of focusing in on that coordination element, to give you kind of a high level view of what scaling impact is and where it came from, and Rob spoke a little bit to this already. For IDRC, really the impetus for our focus on scaling came from our 2015 to 2020 strategy, which included a specific objective related to scaling. And so motivated by that and wanting to kind of really understand what scaling meant or looked like in research for development in the Global South, in 2016, colleagues launched this study that looked across more than 200 research projects, did some in-depth case studies and interviews, etc., to really get a better understanding of what this meant for our work. So this is published in the book you can see on the screen, and in a number of different formats at the website that you can see as well if you're interested in learning more about that. But what we learned through this study in a nutshell is that while there's no common blueprint for scaling, innovators in the Global South do tend to use 4 common principles that guide their scaling efforts. So these 4 principles that you can see on the screen here are really what form the basis of our understanding of scaling impact and our definition of scaling impact. And as you can tell from the name, really what we're talking about here is not just scaling an innovation, scaling up or scaling out, but really thinking about how scaling gets us to the optimal impact that we want to create through our research. And so, as I mentioned, we're going to focus in on the principle of coordination, but just because they're all somewhat connected and to give you a sense of how this all comes together, I'll give you an overview of the 4 first. So the first principle for scaling impact is justification, which says that, in fact, scaling is a choice, it's not an imperative, and that choice should be justified based on a balance of both evidence, so feasibility, effectiveness, efficiency, etc., but also the values of those involved in scaling and affected by scaling or impacted. So that means that we need to consider the views and values of a range of stakeholders, and so it implies that this choice to scale should be shared. The second principle is optimal scale, which really challenges the bigger is better logic of scaling that we often hear in discussions on the topic. And so it says that more isn't always better, and in fact, we need to balance our considerations of magnitude of impact with other dimensions, so including variety of impacts. So we may be aiming to achieve health impacts, improving health, but maybe there are also economic impacts to consider, environmental impacts to consider, etc. Considering the equity of impact, so how is this going to affect different groups differently, for better or for worse? And finally, sustainability of impact. So will those impacts endure or not? Third, and the one that we'll be diving into in more depth today, is the coordination principle, which acknowledges that scaling occurs in complex systems and that it requires coordination of an evolving set of actors to do scaling effectively. So thinking about those who may want to initiate scaling, those who can help to scale, those who might be against scaling or kind of competing with scaling efforts, as well as those who are going to be affected by scaling. And because we may learn through a scaling process about different people, places, and things who are affected by or involved in this process, we need to be really flexible in learning about that scaling system and how we should be dealing with it as we progress through scaling efforts. And finally, dynamic evaluation. So this just says that we shouldn't only be focusing on evaluating impact at a particular moment or a particular level or scale, but we need to think about evaluating dynamic change and the collection of impacts, the different dimensions of impact that scaling produces throughout a scaling process. And this can help us as well in applying all of these other principles. So it can help us to understand this evolving set of actors. It can help us understand justification, and it can help us to understand optimal scale. So today we're really focusing in on this coordination principle. And what it asks us to do is to consider the range of people, places, and things in a scaling system that make it possible to begin a change in scale. So we refer to those as initiators. Those that can facilitate the scaling, so enablers of scale. Those who are impacted by scaling, who experience whether it's positive or negative results of the scaling process. And finally, those that might offer a next best alternative to scaling, who may not actually wish to see scaling take place. And we'd refer to those as competitors. So the coordination principle, in a way, is about getting us to think beyond knowledge users to get from use to impact. And we often talk about scaling impact as a supplement to knowledge translation efforts or a complement to knowledge translation efforts, in that it's not just about getting to uptake or use, those kind of outcome level, but it really gets us to think about how we can push beyond that in our efforts to get to this idea of optimal scale and impact. So just for example, if we were to think about a project that perhaps aims to reduce sodium intake and reduce salt in foods that are available for better health outcomes of populations. As our initiators, who are kind of creating the knowledge or who have this knowledge and see this potential to scale, we would have researchers and funders. Our enablers might be at the outset, we could identify policymakers as those who can kind of help to put in place the policies that will make it possible for products that are lower in sodium to reach the market, or kind of putting in place the regulations that may be needed around this. Manufacturers, we would need to start producing products that are lower in sodium. Advertisers might help to change attitudes around the types of foods that people consume. And of course, consumers would have to actually purchase and consume those products. On the other hand, we might have competitors. So maybe there are entrenched dietary preferences for products that are high in sodium. Maybe there are manufacturers who have an interest in maintaining the status quo and manufacturing products that these new policies or products would not be beneficial to them. And finally, of course, we'd have the impacted. And here, of course, there may be different groups within this who may be affected differently in terms of their health. Is sodium intake being reduced? Is it affordable for everyone, etc.? And just to note that, as well, as I mentioned, this is meant to be something that evolves through a scaling process. So maybe this is what we've identified at the beginning of a project, but later on we realize we're working in one country. There's potential to scale this more broadly. We might note that, in fact, we should be engaging with the World Health Organization to help make this knowledge available in other countries and put it into practice and seek to kind of amplify that impact, get to more optimal impact by working with other countries. And perhaps we realize that it's not just consumers who are impacted, but actually manufacturers are having to deal with the cost implications of producing these new products or other implications that may be there. And just as a kind of to bring us back to the 4 principles, just to note that these are all closely related, as I've alluded to earlier. So the principle of dynamic evaluation should help us to understand the scaling system and identify any new actors that may need to be considered. In turn, strong coordination should help to inform dynamic evaluation, allowing us to kind of engage with this range of stakeholders, get a better understanding of the justification or not for scaling, and in turn help to identify optimal scale. So we're looking at it kind of on its own in this session, but it is closely linked to the other principles. And just on a final note, to give you a sense of how we can put this into practice a little bit later in the session, one of the resources that we have available on the Scaling Science site there is the Scaling Playbook, which helps researchers to think through how they can put the principles into practice in the different stages of a research project, so throughout a research project. And there are tools and exercises in there for all of the principles, but of note here, just to help thinking through mapping the scaling system and thinking of these different categories that we should be considering. So we'll have a chance a little bit later in the session to work through that together. But I will leave it at that for now. And thank you very much. Happy to take your questions after we go through our next presentation, I believe.
Fantastic, Haley. Really great, really clear, and great background on where this has come from, but also what this means to you. That's really, really helpful. So a couple things that resonated with me from that are just the notion of the 4 principles and the interaction between the 4 of them. So I think that's important to keep in mind, and as we continue to explore the coordination principle in more depth. And the second piece that I think immediately pushes my thinking about the conference and the topic of think tanks and partnerships is how you spoke to people, places, and things. And usually when we think about
I think he was speaking to this idea that it's not just about thinking about people. We need to consider places, things as well. So we could have, for example, we talked about dietary preferences as a competitor. It's not necessarily a person, it's something we need to consider. The environment, for example, is something that we've heard we really need to consider in scaling processes that isn't necessarily a person. So it really does broaden our thinking about who and what we engage or map out in our understanding of the scaling system. So I don't see Rob yet, but I know Dina was going to present next. Should we go straight to you, Dina, with your presentation?
Sure, we could do that.
Okay. So do you want me to give you a little introduction?
Okay.
So Dina Lemoski is with Southern Hemisphere. I believe she's a senior partner with that group based in South Africa. And she's worked with IDRC and with others on this thinking about scaling impact through evaluation work, training, etc. So I'll pass it to you, Dina. Thank you so much.
Thank you. I am out of my environment. So just that you know, I'm in a hotel in the middle of Eswatini. So if anything goes wrong, it's way out of my control. I want to share my screen with you. I just want to make sure that you can see the presentation. Trying to get it into presenter view so that I can see my notes, but I don't know if that's working. Anyway, so I will have to, ad lib. I think it's better if you can just see. Are you able to see some slides there?
We can see your slides, yeah.
You can see my slides. I'm going to have to leave my notes here because I haven't been able to get my phone onto the Wi-Fi either. So I've got only one screen and I'm out of my depth at the moment. So anyway, I am Dina Lomovsky, and I am pleased to be sharing my insights with you that I have gained from evaluating the IDRC strategic objective to scale research results together on think tanks, which was an amazing project which launched just before COVID. And thanks to our colleagues at IDRC, we learned a massive amount about scaling. And how it's been applied in the organization, and also sharing some insights from subsequent involvement with scaling initiatives using the IDRC's scaling perspective, principles, and so on. So I think the most important point, and which has already been raised, is the mindset that scaling happens in complex systems with an evolving set of actors. So if we think that scaling impact is the result of a lot of actions that in a research project that build scaling in throughout the process, and that you would have to think about each stage, who are the actors that can help with scaling this impact once it's been achieved. So that is really what we need to be thinking about, and recognizing that because it's complex, things change at all time. We've spoken about this means that people, groups, places, and things that a researcher needs to engage with in a scaling process will necessarily change as the process unfolds. And I think I must emphasize that when one first sees coordination, at least when I did, I initially thought, oh, this is just a matter of putting people together at the right time. But we had a discussion when we were doing the evaluation, and I remember Enrique saying, well, maybe we should actually be talking about production, because we're actually producing this, we're coordinating many different actors, we're finding people at the right time, they're entering the stage and entering and leaving the stage at different times. And it could be that that coordination doesn't, the word itself doesn't embody the full nature of what we're talking about. We're actually talking about strategically bringing in the right actors at the right time in a process in order to enable the project to scale impact. So the implication is that one needs to start thinking quite early on in the project about who is in your scaling ecosystem. And in the evaluation of IDRC's scaling strategy, we asked, yes.
Dina, can you hear? I'm back. Sorry to cut you off right when I get back. I was wondering if you could put the slide in presenter view so we could see the text a bit better. And sorry if you've already tried that and I missed that part. There you go. That looks perfect.
Yeah. The only thing is I can't see my notes, so I'll ad lib. It's fine. I've tried to get my notes on my phone, but I'm in a hotel and it won't let me. It doesn't seem to want to let me into the two devices. But anyway, it's fine. I think I should know it well enough. Wait, show presenter view there now. But can you see my?
But if you, yeah, exactly. Do that.
Can you?
If you switch the screens, it should work.
I only have one screen. That's my problem.
Okay.
Okay. Now I don't know how to get rid of this. Anyway, let me make that smaller. How's that? Okay, wait. There we go. How's that?
That's the best. Right. That one, if that can be possible.
Okay, we'll stick with that then. All right.
Okay.
So we asked IDRC grantees when they started in a survey we did as part of the evaluation. We reached out to IDRC grantees, and many people who were organizations that responded were those that were thinking about scaling or that were involved in scaling in some way. And we asked, when it is that they started thinking about scaling. And for most of them, they were saying that they really adopted a scaling mindset early on in the research process. So 62% said that scaling impact was built into the proposal from the start. For 15%, it became part of the discussions with their IDRC project officers early on during the design phase. And then only a small percentage, were thinking about how to scale at the end. And it seems that the best practice is to think about it early on. And especially if you're trying to think about which stakeholders you want to bring in, because we're really encouraging, and what we're finding is that people are thinking beyond the research community when it comes to scaling. So we really have to think about actors, Haley's already mentioned, the private sector, for example, policymakers or civil society, both as external stakeholders, but also as possibly as program partners. And I'll share some examples with you of that. So one example that we identified through the scaling evaluation, but also doing an evaluation of MCHA itself, which is a really interesting project in East Africa and West Africa. I was more involved in the East Africa evaluation, is that they had three main strategies to enhance coordination. So the first one was that they actually embedded decision makers in research teams as co-PIs from the start of the project. So these were government officials, so let's say they were working on antenatal care, they would bring people in who were in that particular division, in that district or region, or even at national level, depending on where the research teams, the site of the study, and they would involve them in the study as they unfolded. So they were co-PIs embedded in the teams. The second thing that they did was they created a regional coordinating agency, one for East Africa and one for West Africa, because the projects were being implemented in 6 East African countries, and I think there were about 13 funded projects. So the idea was that this coordinating body, which itself was a consortium, it was made up of IDRC, which is a health policy think tank, and a body that was made up of government policy stakeholders and a research team. So there were organizations. So there were 3, the consortium was itself made up of different stakeholders that would bring different insights to the process and also be able to connect the research teams to different spaces where they may find help in scaling their work. The role of those coordinating agencies was to connect the research teams to each other and to government decision makers. Now, also because the research teams already had decision makers in their teams when they got together, then there were also, if there were 6 researchers in the room, there were also 6 policymakers in the room. So that enabled the processes to be infused with the thinking of what will enable this project to scale impact from the start. The policymakers will be able, there was a constant feedback loop to say, well, that's not realistic, that's not going to work. If you want it to work, you need to align it to this strategy of government and so on. So, and then they were constantly thinking the role of the coordinating bodies every time before they met, let's say with the Board of Policy Forum, they would get together and they would, with the research teams, to discuss how are we going to communicate what's going on. And that happened throughout the process. So a big part of their role was also to strengthen the research teams in knowledge translation and how to communicate with decision makers. So that was a great example from MCHA, just to show the complexity and some of the strategies that can be adopted for coordination. And then Haley already provided the example of the sunflower oil, where the researchers worked closely with private sector to distribute the oil. So there were, I mean, when we think of private sector, we usually think of big corporations, but in this case, it was lots of little small shops throughout, the rural countryside that were helping to sell, and in this case, in some cases, caps of oil. People will be able to buy the oil by the capful. So it was a lot of different providers who were then able to distribute the product and ensure that the impact, which was the improved health from the oil, was able to be scaled. So it's really, I think the key lesson is, think about upfront who the potential actors are that will help to scale impact, but also then to revisit it from time to time because they will change as your needs change, as your process develops, as your innovation or your policy change process unfolds. You may need to bring in different stakeholders at different times. So thinking through not only who is in the ecosystem, that's what I've learned, but also who is not in the ecosystem also helps researchers to think about the scaling strategy. So I'm working with also an IDRC funded project which is trying to scale a back to school project that exists in Tanzania, and they want to scale it to Kenya, and Ethiopia. And they realized, for example, that when they did the ecosystem mapping in Tanzania, a key part of the project and the stakeholders that were part of helping to scale it were NGO service providers who were working with out-of-school girls. And when they did that same mapping exercise, they realized that they don't exist in the ecosystem in the other countries. Or if they did exist, they were very much clustered around the main main urban areas or highly populated areas. And that perhaps those who needed the service the most, who were most marginalized and vulnerable, were being excluded. So thinking about who is and who is not there, present in that ecosystem, means that they were able to identify strategies to reach those areas if it's important for them to scale equity. So IDRC also talks about not just, we don't only think about scaling impact in terms of size, but we also think about scaling equity. So how can we make it a more equitable service, for example, or reach those that need it the most? So it might be that they needed to invest more in building support for these girls in rural areas in order to reach them. So, and that is an important part of this project. So there was a side, I can't see the conversation now because I'm in presenter view, but there was a conversation happening on the side around whether we can call things something else. It does, but in this case, it really kind of triggered a really good discussion when we were doing the stakeholder mapping as part of the scaling strategy for this project. And when I introduced the idea of things, then people started exploring other options, actors, especially as competitors. So what emerged is that stigma and social norms was a really big discriminator in terms of competing for a particular group of girls not to come back to school, those girls that were pregnant or who had who were early young mothers. So there was a lot of stigma, and they were then discouraged from going back to school. In some cases, they were banned from being in schools. So if this project wanted to reach those people, it needed to consider working with organizations that could reach those girls, because if they're only working with the government stakeholders and the schools, they're not going to reach them. They also needed to working with unusual partners who are addressing stigma of these kinds of social norms or behaviors. So it expanded the notion of who's a valuable partner in this research project. Of course, it's not without its challenges. So some of the challenges that people raise is, coordination, working with stakeholders, engaging stakeholders, consulting with stakeholders, revisiting actors. It takes time, it takes money. Sometimes the distances between the researchers and the research sites are hundreds of kilometers on very poor roads, and it makes ongoing coordination very difficult. So it's something to think about, and that's why forward planning and perhaps setting up processes, local people who can assist with those processes can be quite important. And then again, you're extending the arm of the research project. So you need to think about that up front. Also, stakeholders change and move positions was a very big problem in some of the projects in IMCHA, for example, where the embedded researcher was an ideal person at the start of the project. They were well positioned, well connected. They were very interested in the topic, but then they get a promotion or they get shifted to another area and they're no longer interested or they're no longer funded to participate. So that means the research project has to either fund them or they have to self-fund their participation. And that becomes tricky, especially if they're co-PI, they're visiting the sites and so on. So that is something that one needs to think about. The other thing is that we all think, of course, partnerships are wonderful. We want people to collaborate and it's so nice, but they take time, they take money. Partners are often very much focused on their own funding obligations or commitments. And in the case of IMCHA, again, even though there was a coordinating body, each research team had a separate contract with IDRC. So they were actually, they were responsible for their own contracts. They weren't responsible for collaboration. And we did a subsequent study on just in Tanzania, because IDRC there were such good results there. They wanted to know, what's the effect of having multiple projects in one country for scaling? Is it beneficial, and if so, how can we support that? And what we found is that there's a lot of potential for scaling impact if these projects work together, but that wasn't going to happen within that particular funding window, because there was no support infrastructure or financial infrastructure to support that cooperation. So now we see projects in the next phase applying together, not even maybe to IDRC, but maybe to other development funders, for opportunities where one project might be working with, let's say, young mothers, another project might be working with an obstetrics unit, and they find opportunities to bring those projects together to connect them and to create a more packaged service. So one solution for that is, for example, in Carrier, which is it's a climate research project in Asia and Africa, and it's closed down now, but they had something called an opportunity fund, where researchers could apply to jointly work on, research teams could apply to jointly work together on particular emergent ideas. But they found that didn't really promote scaling either, because there were only researchers working together. So they didn't invite other actors into that, other policymakers or other actors that could help with scaling. So the idea that it will just happen organically because it's desirable is not necessarily going to happen, and especially not in the short time frames that many of these development projects are funded for. So what are the implications for us, for researchers, for funders of research? So strategic coordination requires project officers or research managers to think and act strategically. It requires them to review and reflect on the partnerships as the scaling process unfolds and as new opportunities emerge. So one needs to revisit from time to time when which partnerships are still working and which new ones might need to be identified. So for researchers, the implication is really that when you're designing your research programs and scaling strategies, you need to consider which actors need to be engaged in the project, at what stages, and in what ways, and consider how these may change over time. And for funders, how can research funders support competencies, skills, and resources required for their staff or grantees to coordinate multiple stakeholders across the scaling pathway? And here I'm talking about all the way from, let's say, innovation, proof of concept, through to actual scaling up, out, or down. There are cases of scaling down, I think Rob asked me to mention some. I'll talk later, but if there's any questions around it, but some kind of perspectives from the South. And I mean, my biggest challenge that I have with a lot of implementation research projects or projects that are designed to scale is that they inevitably have more resources than the governments that are expected to take them over. So they will come with wonderful equipment, fantastic skills, amazing training methodologies, and so on. And they work in theory, they work as a research project, but when those resources are pooled and the government has to take it over, it might not necessarily work in the same way. And there was an example in IMCHA where there was this very successful distribution of birth kits to mothers in rural areas, which included medication, antibiotics, antiseptics, and so on. And they found that they were able to reach far into the rural areas, and they were able to achieve a good critical mass, that they could actually have an impact on the rate of death in birth. So, wonderful results, wonderful impact, amazing. But when the project ended, the budget of the government to provide these kits was only a minute part of what the project had to scale and distribute at the scale that big scale that this project was operating. So what it meant was that they reduced the number of birth kits. They realized that it's a good strategy, reduced the number of birth kits, and ended up inevitably probably only reaching those people around the immediate vicinities of the hospitals anyway. So again, making those people who are further away from the facilities and most marginalized possibly the least likely to receive the support. So scaling equity in that sense becomes a real challenge when the scaling project needs to reduce. So that's what I wanted to share, and I'm happy to take comments and questions later.
Fantastic, Dina. Thank you very much.
Thanks, Amy, for sharing the name of Korea.
Yeah. Thank you, Amy, too. But Dina, really, really helpful. It's increasingly important to me that we continue to connect on some of this practical experience you've had around the work on this topic and what we can learn from that. And thanks for elaborating on that for the group today. I really, for me, immediately resonates these notions around language. I'm believing how important language is more and more in our world, and the notion of coordination maybe not being an expansive enough term. I think I agree with you. I really do. And then this notion of things being difficult to work with. It has been, for me too, a difficult label, but I think you've spoken well to how else do you describe things like a forest and a culture and a institutional norm. And so I think it's a tough label, but there are a number of things in any scaling effort that can have a great effect on the success or likelihood of scaling impact happening. So great examples, really, really appreciate it. So what I'd like to do now is open up Q&A with Haley, Dina, but the rest of the room too. I don't think it just needs to be about clarifying questions. I think we can have some reactions from colleagues. And one thing I'd ask you to do, which would be really helpful, is to introduce yourself when you ask a question, or just to type it in the chat too, if you don't have an immediate question. So we begin to get a sense of who's.
I think maybe we can just open it up. So I've seen a couple of questions in the chat. Rob, feel free to jump in if you want to try again. But take your time if you need to figure something out. I had seen a couple people entered questions in the chat that maybe we can take. And I think if you want to come in to ask your question yourself, speak to it, you should be able, as Rob mentioned earlier in the session, you should have a blue button in the top right corner to request to share your audio and video. If that happens, hopefully I will be able to allow you to speak. And if the organizers are here and you're seeing requests that I'm not accepting, feel free to let 2 or 3 people on screen and we'll take their questions as we go. I don't have any requests yet. I'll keep watching. So I'm just going back to, I think Keith McLean had asked a question about the importance of upstream stakeholder mapping and definition of audience, as well as a problem statement in facilitating midstream and downstream coordination. So maybe we can start with addressing that one. And Keith, feel free to introduce yourself a little bit as well in the chat. But maybe I can start on that one, and Dina, if you want to come in with anything additional, certainly do. So I think if I'm understanding your question correctly, Keith, I think it's about more than just audience, and I think it relates to maybe what Kike is saying and this discussion further down. It's about really like this two-way engagement. So yes, reaching those upstream and downstream actors, but also kind of that multi-directional engagement with these actors, because what it comes down to is not only, as I think Enrique was saying in the chat, putting forward our own notions of what should scale, but understanding kind of how that's situated in relation to kind of other initiatives, or how this will affect people, and that idea of justification for scaling as well. So I think it is, in a way, it's thinking about kind of expanding your audience, but also really, I would say, expanding how you're engaging, and really considering the inputs that you could get as well by doing so. I'm not sure if that answers your question, but that's just an initial response to it. And I don't know if others would add to that.
So I think one of the things that I lost when I lost my notes was explaining how you could involve stakeholders, and just to giving an example at different stages. I'm not entirely sure, Keith, so you're welcome to take the mic, how you use the terms downstream, midstream, upstream, because I know they're used differently by different organizations. But thinking sometimes downstream is, demonstration on the ground, and upstream is how to get that into policy. When we think about scaling as a process, we've been thinking about how to move it from, if it's an innovation or a policy idea, how to move that as it develops through the research project into the broader system, whether it's a policy process or a government health system or whatever it is, and that there are different actors that are playing a role at the different points in the system. So, for example, when this organization, the Back to School Project, realized that they needed to work with this hard-to-reach group of girls, they decided that they could, and they needed to address stigma, that they would be doing much more work with organizations that are working with these girls in the data collection phase. So how to access them, to speak with them and with their parents, and bring them in as stakeholders to discuss, the issues that would prevent them from going back to school and how they could be supported. Then again, in the sense making, the plan is to go back and say, look, this is the data we've got. This is what we're understanding. How does it make sense to you? How do we interpret what's coming out, what the different stakeholders are, and what would your recommendations be? And then to actually work with those organizations in the actual implementation of the model, so that they can cluster around the schools and they can support the reintegration of these young women in schools. And then to address policy. For example, in Tanzania, policy which has been, I think it was, which excluded pregnant girls from going to school, to actually, on a system level, to address those policy barriers, and make it so. What they do is girls tend to they have schools for pregnant girls. We must be coming to you in America soon, with the anti-abortion laws, but. Yeah, so that is kind of thinking about how to engage that actor in different steps, or that of the process, and also the issues around that particular actor at different steps in the process. So it's not about engagement only, it's actually about involving them. And then to Enrique's point, they should then be deciding, and part of the decision of justification to scale, should this project actually, is it worth it for them? Or should, maybe there's alternatives for them that are better, now that they're young mothers, for example.
No.
We can somewhat hear you, but it's cutting.
No. Okay.
Maybe you have to chat. Put in the chat, Rob. We'll read it out for you. Keith, I'm not sure if that answers your question, or if that's close to what you were thinking.
Okay, partially yes. So feel free, Keith. I'm not sure if you've requested to speak. If you have, I don't know if OTT can accept it, but feel free to, if you'd like to come in and elaborate a bit more, that's great. But otherwise, seeing a few more questions in the chat. So maybe we can take a couple more before we go into the last portion of the workshop. So from Louise at OTT, and of course OTT and Southern Hemisphere have been working together on the evaluation of IDRC's scaling strategy, as well as this scaling exchange. So she said something we've been talking about is how much time and energy cross-sector collaboration or coordination takes, getting people out of their silos, etc. And just the limitations of the short-term project funding model. So knowing this isn't going to change anytime soon, what are some of the things we can do? Thank you for that, Louise. So maybe I can start again, and Dina, feel free to jump in. But certainly, obviously, this idea of coordination requiring engagement with an evolving set of actors is not going to be very conducive to kind of a short project or kind of defining an end date far in advance. But we know that projects and that kind of cycle are the reality. But I think we have started to hear some strategies that we can use that will make it easier to scale. I think recognizing that scaling is never going to take place in the frame of a single project. So it could be kind of phased approaches to programming where we're planning to kind of look at the end of a project at where we're at and consider kind of intentional approaches to support later phases that are more specifically focused on scaling. And providing as well some sense of continuity for research teams, for example, in terms of how they could take things forward beyond a defined time period. We've heard of some more flexible funding mechanisms, like I think Dina mentioned some of these, like opportunity funds or synergy funds, where researchers may be able to identify in the course of a project there's actually another scaling opportunity they could take. They just need some more resources or whatever it may be than were originally planned. So that's another thing that can be put into place, is this ability to kind of apply flexibly for additional opportunities as they're identified in a scaling process. And I think as well, and one thing we've heard from the researchers we support through this scaling exchange process, where we talk to researchers across the Global South about what they need from funders and development agencies to put these principles into practice. But really having kind of a learning orientation towards scaling as opposed to an accountability orientation of like, what was your impact in this moment, and really being dedicated to learning about where things are in the scaling process, what opportunities there might be, and being committed to kind of acting on that, which may mean putting further resources into high potential ideas, coordinating with other funders to make sure that work is taken forward, etc. So those are just a few thoughts. I don't know if you'd add anything, Dina or Rob.
Let me try quickly. Can you hear? Wow. Okay. I'm so sorry. Yeah, I'd agree with that, Haley, and I think I missed some of the conversation before, so I wouldn't want to take it in another direction. But maybe to take on Enrique's point from earlier and help us transition into the activity, I'd say I think you're raising a very important issue, Enrique, about giving up control and understanding that these people, places, and things are rarely agents of the scaling or the research to impact process, by whatever jargon we call it. They only become agents when they are affected or they're engaged. And yet they have great control over the success of our efforts. And so one of the ways that we've tried to work in that engagement and that understanding of the effects our research might have on people, places, or things is through a exercise where we try to translate those three groups into actually a scaling map. And so I'm going to share some slides now that will introduce that mapping process. And hopefully then we'll spend a little time undertaking that exercise as a group and kind of reacting to it and learning how you feel this works in your context.
You know, I just want to say, while the slides are coming up, Rob, you know, it's a real site of negotiation. We're busy with we've just evaluated a project, a research It's a peer mentor, mother mentor model that's already been scaled up all over Africa, and now UNICEF are pushing, I think, for the Department of Health in South Africa to scale into government. And there's a lot of contestation. It's not the researchers are actually at this point the least powerful in the process. There's a lot of evidence that it works, but the questions now are more around how is government going to sustain it? Where are the facilities going to come from to support it? Research have been funding, UNICEF have been funding 2 years of implementation. What happens when they pull out? Are they actually meeting the right targets for the department of health that they're interested in? There are all sorts of employment issues. It requires a particular people to be employed who are HIV/AIDS positive, and the government saying, well, we can't do that. We can't force people to disclose their status in employment. We can't put them on the payroll. So it's a real site of negotiation around this process now, and the research teams are the least powerful. Actually, it's beyond. So it's quite interesting.
No, absolutely, Dina. And I think understanding and accepting those power dynamics, the role we play in creating impact, is very different than thinking about running a research project that we want to have impact. So what I'm going to do, if it's okay to keep us moving, is just introduce an activity we'd like to undertake as a group to test how we might put this idea into action. And so it's one of the activities that's now found in our Scaling Playbook, which is a guidance document that we give to researchers who are beginning projects with IDRC. And what we're trying to accomplish with this playbook is really try to share some of what we've learned through this 7-year now effort on scaling, to try to pass along some of that knowledge and invite our researchers to help us to grow that body of thinking. And what's in there is a bit of an elaboration, as Haley has noted, of the complementarity of a scaling science to these notions of knowledge translation, or to what's called implementation science. And so those two issues are generally based on getting research into use or into action. And as I hope we've elaborated, scaling science is really the plethora of issues that involve moving research from action into meaningful, sustainable, equitable impact. And it is geared and designed for researchers. And so we hope it offers some practical tools based on research that can help put this immediately into your work if you are a researcher thinking about how this means something to you. And so one of the activities that's in this playbook is called the Scaling System Map. And here's a rough image of it. But effectively what it does is asks the user to translate people, places, and things into 4 categories and how they interact with their project. And so Haley actually spoke to this a little, but you can think about at least 4 different groups of actors. And initiators are those who make it possible to scale. And so often this has to do with funding, or it has to do with a new idea, a thing. But it can also be issues such as a willing community that wants this change so that they've been involved in the justification that the project could bring about. As you think a little further along a pathway to scale, you'll likely encounter enablers. And those are the people, places, and things that really facilitate scaling. And so in the IMCHA example Dina spoke to, we heard about active knowledge users. So hospital administrators, doctors, nurses, people who actually enact the change that should come about from the project. So that knowledge translation process becomes very important too when we think about enabling environments. The next group is one that's rarely talked about, we find in the literature. The literature reviews we did for this study are the forces that actually don't enable, but can constrain the scaling effort. And you usually would think then immediately about competition as in something you'd want to outdo and overcome. Maybe a custom, a local custom that is ineffective, a policy at an organization that could be changed to improve the results of the organization. But competitors can actually be better than your own solution. And this has been a really big challenge, but we've learned from researchers who've been able to identify that. And this is an example of when scaling down, or same scaling, in fact, can be the best route forward. And so you think about an alternative idea or a reshaping of the idea of your project for a different context. And perhaps it's better to take that alternative approach in a different context or even in your own. And how do you identify that moment when the better than solution has arisen? Really challenging work, but we found that using a map like this helps set up a process where it can be planned and perhaps more effectively enacted. And then the final category here are the impacted. And again, these can be people, places, or things. But it really, I hope, embraces the important point Kike has made earlier in the chat around understanding a shared process. And rarely, if ever, do we as researchers or innovators or think tankers really control our projects or our efforts having impact. That control is nearly entirely owned by those who feel the impact and either embrace it or decide not to engage with this effect. And so identifying those who will be positively impacted, those who will be negatively impacted, and thinking through people, places, and things within this category can really help understand how we might take more of a systems approach with our research and innovation. And so we're actually going to, as a group, try to undertake this exercise on a fun mural board that's been created, and we'll share that shortly. And we're going to use a very broad, a very wide open, shared scenario to walk through. And so we're going to pretend that we are researchers within this scenario and think how we'd map the scaling system. And we want you to be creative. We've given very limited details, so this is accessible and is open to a broad range of ideas and inputs. And so effectively what we're saying is that there's a project and it's worked with an interactive multimedia software coupled with professional development to try to improve learning outcomes for children. And so now researchers, us, together with the teachers associations, are building a scaling initiative for this project. And so what we'd like to invite you to do is visit that mural, and I'm going to turn it over to Dina to give you a little explanation on how to use that platform if you haven't, but to begin filling it out with your ideas, what the scaling system for this wide open project might encompass.
Thanks, Rob. I think what's important is when you enter Mural, because I see that the thing's already been, enter as a visitor, then it won't take you through a login process. I'm hopefully sharing the mural on the screen now. Can you see it?
We can't see it on the shared screen, Dina.
You can't. Okay. Wait.
Maybe I could try.
There we go. Now?
Yes.
And now can you?
Yes, we can. Yeah.
Okay.
Great.
So, so if you zoom out on the bottom right-hand side, there's a little control bar, and it's got a plus minus button. And if you zoom down, it makes the whole canvas smaller, and you can see it all at once. Or you can increase the size, and you can get to different parts of the canvas by clicking on the hand, and then you can move the canvas around so that you've got the part that you want to look at in your view. Then if you want to interact with that canvas, you have to go off that move mode, and you can on mine, I'm not using a Mac, but I can use 2 fingers to zoom in and out, or I can left click and move my mouse to move the canvas as well. And if you want to write, you just double click on one of these sticky notes and you simply write into it. If you want to create another sticky note, you just go into a blank space and double click and one will pop up for you. Okay? Otherwise, just play and have fun. So, Rob, do you want to talk us through this example, or should I talk people through the mural board?
I think I'll talk you. I think you'll see the scenario language is very simple education project. What does the scaling system look like? And so what are some of
again?
I can come in and quickly go over this scenario. But yeah, thank you, Dina. Dina's showing the scenario. It's very quick, a few sentences about a project on multimedia and teacher development. So we know a lot is left to the imagination. That's intentional. And what we want you to do is just take a quick read through this. So the project worked with interactive multimedia software coupled with extensive professional development for teachers to enhance teaching and improve the learning of children. Now researchers with teachers associations are in discussion with the Ministry of Education about scaling throughout the country. So what we want you to do is work with this, and there's probably some hints built into even this short description, and start thinking about who you think the initiators, enablers, competitors, and impacted would be. And like I said, maybe there are some in there. Maybe you can imagine there are others that haven't been explicitly noted, but that should be considered in a project like this. And you can start entering on the sticky notes your ideas about who should be mapped into the scaling system. And I think we're going to
Yeah, sorry, Haley.
Oh, I was just going to say, I think we're going to give about 5 or so minutes for people to just think through that and enter their ideas. And you can also think about, to this idea of it being an evolving set of stakeholders, when would you be considering revisiting this mapping in the research process? So are there moments you can imagine it would be particularly useful, or a point in time? So that's over on the right.
And just to say that there's a bit of a cheat sheet on the left. So there's a case study, example of the sunflower case study in case you get stuck. You can go and have a look in that bottom left-hand corner to see and give you some idea.
So feel free to keep working away. Is there anyone who wanted to come in to share their thoughts on things they put in here? I know Enrique has mentioned in the chat some of the things he was observing. For example, possible overlap in some of these categories. Are the negatively impacted often also going to be competitors? And I think we sometimes see cases, as I mentioned, where enablers may also be impacted, such as that example of consumers that we talked about earlier. But I don't know if you wanted to come in on that, Enrique, or if others had things they wanted to share. And again, if you want to speak, you can click that blue button in the top right. And yes, Keith, I think you're right that we often see these different people, places, and things coming up in multiple places, and maybe it just gives us a sense of the different ways in which we may need to engage those, to engage them, and the different considerations in that engagement.
And I suppose the more they come up, I wonder if there could be you may prioritize, although there may be an outlier that's really a key gatekeeper. So maybe frequency isn't necessarily the biggest indicator of engagement, but it could be.
Mm-hmm. And Anna is just noting conflicting interests, long-term changes should take into account a more flexible approach. Yeah, that's a great point, because those things might emerge over time. And I see at least one person has come in on this idea of what point in the research process you might revisit this. And I think that's obviously, it's a difficult question to answer with such a brief and kind of high level scenario. But I think this idea of people are coming in with, we need the data analysis and the learning to help us decide on that. And I think that's really the point. And it relates to this idea of dynamic evaluation. It's just looking at when will we have evidence that might make us think about new people, places, and things who should be on the map, or how we engage differently, etc. Hey, Enrique, I see you made it onto the screen. Did you want to say something? Okay, we can't hear you, Enrique. It doesn't look like you're muted, though.
Can you hear me now?
Yeah, we can.
Sorry, can you hear me now, Hayley? Dina?
Yeah.
Okay, good.
We can.
Yeah, I was reflecting on this, and I've been looking at the. Thank you very much. First, Hayley, Rob, and Dina. I've been following this process as well, and I'm very interested. I'm just reflecting on some things about the tools we're using, and so I made a comment there about the language, such as competitors, and whether that to some extent predisposes the type of collaboration that is going to be possible. Right? Because we want everybody in the room to think collectively about the roles that everybody should be playing to see that impact scaling to that optimal level. And I wonder if the tools are predisposing those. And so I keep going back to kind of another IDRC method, the outcome mapping, as a very almost very basic, very pure tool where it just brings everybody in the room and then says, well, what is your pathway? What is your journey going forward? And does not predispose their roles, whether they are, impacted or, likely to be competitors or potential allies. We just trace their potential pathway into that future where their behaviors are conducive of change in this scale, having optimal impact. So that was just a reflection. I kind of by looking at the tool and trying it out with others, it just made me think that there might be something there in terms of not using the language that we're using, so that collaboration might be easier. That was it.
Thank you. That's a great connection to make, and maybe something to think about the kind of complementarities among these different tools. Thank you. So we have about 5 minutes. Sorry, Dina, were you going to come in?
I was going to say they both have as their philosophy systems thinking and complexity science, so that would work well together.
Well, I think Rob hasn't been able to rejoin as a speaker, but really we have about 5 minutes left in our session. And so we did just want to close it up and thank you all for your participation in this. We hope that it's been useful to understand a little bit more about scaling impact and specifically this idea of coordination. And I think all of your insights and reflections on going through this exercise are really useful for us as well, as we think about using it going forward and how we kind of use this type of mapping. So thank you so much. And we've shared some of the websites and things where you can look for more resources. So we hope that for those of you who are interested, you do dive in. and we hope to have future opportunities to discuss some of this with you. But thanks as well to Dina, to Rob, to IDRC colleagues I know are on the line, Amy, Shaliza, and Petronella from Southern Hemisphere as well, who all helped, and to OTT for organizing the conference and letting us hold this session. So thank you so much, and I hope you enjoy the rest of the conference.